Ok, bonjour, bonsoir, chers défenseurs de la lutte anti-tabac et bienvenue à ce webinaire organisé par l'Alliance pour le contrôle
Good
du tabac
morning and
en
good
Afrique
afternoon. Welcome to this webinar organized by
à l'occasion de la journée
ATSCA,
mondiale
Africa
et
Tobacco
célébrée le 7
Control
avril de chaque
Alliance.
année. La célébration de la journée mondiale de la
The
santé de cette année
celebration
marque également
of the World
le
Health Day
60e anniversaire de la création de l'Organisation mondiale de la santé
marks
OMS qui a vu le jour
the
en
celebration of
1948.
the
Et
creation
le thème
of
choisi pour la
WHO that
présentation de
was
cette
created in
fois est la
1948.
santé pour tous vous dites. Et ça passe
And the
bien
topic
évidemment
for
par un
this World
ensemble de mesures,
Health Day
notamment
is
la lutte contre le
health for
tabagisme.
all through a
Donc,
tobacco-free
l'Alliance
generation.
pour le contrôle du tabac. Dans le cadre de cette célébration, a
As
organisé ce
part of this
webinaire.
celebration, ATSCA is organizing this webinar. It's the voice, the sound is very bad on the end of the speaker. The voice is breaking seriously.
Riche dans la lutte anti-tabac. Mais
Can
avant de les
someone tell him that
présenter
his voice is breaking seriously?
à tous les participants que le webinaire est disponible en français et en
This
anglais.
webinar is available in English
Cliquez tout
and
simplement sur
French.
l'icône du globe
You
pour
can click
sélectionner
on the
votre langue.
interpretation icon at the bottom of your screen and you can choose your preferred language. And you can also ask your question to the panelists in the chat box and we'll address all these questions. You can also share your experience in the chat box as it were. Ladies and gentlemen, dear tobacco control advocates, we are now going to get into the presentation of the panelists.
Je commencerai par le professeur
I will start with Prof. Kumako Vigno Vincent. He's a neurologist.
Santé communautaire et un accent particulier sur la promotion, la prévention et la prise en charge des maladies non transmissibles en général et des accidents vasculo-cérébraux en particulier.
And dealing with some non-communicable disease management.
Du Togo de 2011 à 2021.
From 2021-2022, he was the coordinator of the National Tobacco Control Program of the Ministry of Health of Togo. He was a bureau member for WHO, FCCC, COP7 and COP8, led and participated in several thematic working groups within the Ministry of Health of Togo and the development of various regulatory tests of tobacco control in Africa and around the world.
En Afrique et au niveau international a été récompensé en 2020
He received
à travers le prix
an award in 2020, the World Tobacco Day 2020 awardee.
Autre intervenant et pas le
Other
moindre,
speaker,
et j'allais dire pas la moindre, c'est le docteur Ati Singh,
Dr.
qui est
Ati
médecin de
Singh, is a public health physician, faculty member with the School of Public Health at the Kwame Nkrumah University of Science and Technology in Ghana. As she has extensive experience in tobacco control research, including smoke-free policies, illicit tobacco trades, and tobacco taxes in Ghana. She led the drafting of the Africa Tobacco Industry Interference Index in 2021 and 2022. And this afternoon, we also have as a panelist Mr. Zanele Zuno, chairperson of the Green Youth Network. He's the governor of the South African Tobacco Free Youth Forum. He's also a former participant of Youth Parliament, a youth mentor, trainer, and business advisor with a passion for skills, development, and career guidance. He has passion for tobacco control and work a lot. Creates the South African tobacco-free youth to protect.
Afin qu'ils s'élèvent contre les tactiques vicieuses de l'industrie du tabac
to fight against the manipulative tactics of the tobacco industries.
Dans le processus législatif. Nous allons également suivre
cet après-midi on this call,
qui a obtenu un doctorat en psychologie et en promotion de la santé à l'université de KwaZulu-Natal à Durban, en Afrique du Sud. Elle a bénéficié de deux bourses de recherche
two postdoctoral research fellowships, University of KwaZulu-Natal. The second one, the Center for Tobacco Control Research, Education, University of California, San Francisco.
À San Francisco. Un centre collaborateur de l'Organisation mondiale de la santé.
WHO Collaborating Center for Tobacco Control.
Dr. Ebe est membre de la Société
is a member of the Society for Research on Nicotine and Tobacco.
Research on nicotine on tobacco, en abrégé en anglais.
Lead investigator on tobacco adult tobacco service South Africa, tobacco endgame in Africa.
La première enquête mondiale sur les adultes en Afrique du Sud
to e-cigarettes and hookah, marketing and advertisement.
L'exposition des étudiants universitaires au marketing et à la publicité de la e-cigarette et du narguilé, ainsi que le projet Tobacco Endgame.
Tobacco
Elle est l'auteur de plus de 50 publications universitaires, 50 articles publiés
has more than 50 academic publications, including over 40 papers in peer review journal. Ladies and gentlemen, dear tobacco control advocates, these are the brief of the members of the panel that will engage with us this afternoon. The first person is Prof. Komako Vigno, who is a professor at University of Kara, professor of neurology.
Si le professeur m'écoute, bonsoir et
good
bienvenue.
Afternoon, Prof,
bonsoir, professeur.
And welcome. Prof, good afternoon. Prof, are you on the call?
Est-ce que le professeur m'entend?
Prof, are you on the call? Yes, he is on the call. Prof. Komako.
Ok, bonsoir professeur et bon après-midi. Merci d'avoir accepté d'édifier les populations ou alors les membres de ce webinaire sur
Thank you, Prof,
la
for joining
question.
us. Thank you to take us through the
Professeur, vous avez la parole.
Background and context, general provision, and useful information. Good morning, everyone. You all welcome to this webinar. I am pleased to address the issue on tobacco control interference and the risk in African countries if we do not properly fight against this epidemic, tobacco epidemic. I don't know whether all the countries have prepared the documents on the interference of tobacco industry in our policies. This is not done in all the countries, but countries like Uganda, Kenya have started working on that. But for the Francophone countries, I'm not really well informed, but I don't know if there are some Francophone countries have also developed such a document on the interference of tobacco industry. If this is properly documented, I remember that this was documented by Togo, and I presented that back in 2015, where we were presenting the decrees and decisions of legislation in Togo. Yes, it's true that the tobacco industry continue interfering in Togo, because there were some decisions that were taken in Togo reflecting the position of the tobacco industry, but I'll not get into the details of that here. But let me talk about the health consequences of the interference of the tobacco industry. Please, can I continue? I just want to make sure that I can continue. Can I continue? Can anyone hear us? Can you hear us? Hello? Yes, we can hear you, sir. There is interpretation going on. Can you switch on your camera, Dr. Kumako, please? Can you just switch on the camera so that we can see? You can switch it off later so that we can just see who is speaking. Yes, it's good. Can I proceed? Yes, you can. Let me talk about the sanitary or the health damages caused by tobacco in Africa. Or should I just focus on the interference of tobacco policies? There are so many diseases in Africa. I am currently in a session on a cardiovascular accidents, and many African countries made presentation here, and tobacco use is contributing to the increase of cardiovascular accidents in our countries. And this is one of the major causes of disability in our African countries. And most cases of hospitalizations are due to cardiovascular accidents nowadays. And not fighting against tobacco use today, it's an open door for more damages in our country, because the age where the cardiovascular accidents occur is 60 or 70% before 65 years, which means that the people that economically are supposed to contribute to our countries are facing the consequences of tobacco use, so cannot contribute duly to the economy. So if we do not fight against tobacco use, our country will continue or remain still in underdevelopment. The people that need to drive our economy, if they are affected, they cannot be productive. I'm talking about cardiovascular accidents. Why? Because in most of our review, it is the first cause of mortality, and this is due to tobacco use. And if I consider some other complications are due to the fact that tobacco use lead to some cancers, our countries, we have no resources, which is a clear fact. When we have a huge number of cancer people, and most of them are youthful people, 40, 45 years of age, are also affected by cancer if the CSO do not act properly, because for most of our leaders, they think that tobacco use damages will not be felt today, but it will be in 15, 20 years down the line. And if we do not act properly, our people will be sick. And this is going to cause a very outstanding damage on the economic life of our people and health aspect of our people. We could testify that there was a huge damage due to COVID-19. We closed our borders only for a few months, but economically, we recorded an outstanding damage in the African economy. So if we do not fight against tobacco use, we open doors to more damage, because tobacco is the cause of so many other diseases, and I mentioned some of them. So tobacco is destroying our forests. Tobacco is being grown instead of food stuff. Wood is also used for the manufacturing of tobacco. So if we're not careful about tobacco control and do it properly, this is going to put a halt to our development agenda. So we know that there are so many complications, because all the panel members here know that there are so many consequences of tobacco use. We have more than 4,000 toxic products, and we can suffer from cancer from our hair up to our toes, lung cancer. A lot of research have proven that for cardiovascular accidents, it's because we are having a workshop on this currently on African continent. All African countries are taking part in this workshop, and we are making presentation on the realities of the cardiovascular accident and the risk factors. And I noticed that one of the risk factors, which is cross-cutting across the continents, is tobacco use. So CSOs need to be strong to fight against tobacco. Thank you.
Ok, merci. Merci au professeur pour
the prof for setting the stage.
De l'impact du tabagisme dans le système de
address the impact
il a
of tobacco
les maladies, les accidents vasculaires,
and he mentioned a few diseases, and particularly cardiovascular accidents. And one of the major risks for those diseases is tobacco use. He also mentioned cancer, how this can destroy our people, and tobacco has an impact on the life of our people, and also it leads to deforestation as well, because there are forests that have been cleared in order to produce or to grow tobacco. So these are some of the highlights from what Prof. Komako said. I would like to take this opportunity to thank him, and we hope he's going to avail himself to take a few questions from our participants. But before we get to the questions, we will get into the other panels about the tobacco industry interference. We have so many new smokers joining the group of smokers.
En violation de l'article 5.3 de la Convention cadre de l'OMS pour la lutte anti-tabac.
A breach of Article 5.3 of the FCCT.
Une spécialiste
I'm going to introduce to you a specialist who is at the Public Health School of the University of Kwame Nkrumah. We've lost the speaker. We're sorry. In Ghana.
Good afternoon, Dr. Ati, and welcome.
Good afternoon, everyone. Yeah. Could you please project my slides?
Okay, you have 20 minutes for your presentation.
Yes, I think my slides, yes, yeah, that's it, yeah. Thank you. Thank you. Yes, good afternoon, good morning, everyone. So I'm Arti Singh from the School of Public Health at KNUST, and my presentation is just an update on the industry interference in policy when it comes to the African region. Next slide, please. Yeah, so the overview of my presentation basically is I'll just give a small introduction, then I'll just follow it with some of the regional updates from 2021 and 2022 and what really happened between these 2 years. And then I will just go into a bit more detail into some of the findings across the thematic areas within the index. We have some 7 thematic areas that we measure what happens when it comes to country responses to the tobacco industries. And then I will go ahead to give some recommendations that we've been able to come out with after evaluating the industry interference among the countries in the African region. Next slide, please. So just by way of introduction, yes, next slide, please. So as the previous speaker has already highlighted the effect of tobacco and next slide, please, yeah, and the effect on the human body when it comes to different kinds of cancers. But the interesting aspect about this is that the tobacco use globally is actually declining, and many countries in the developed world are not having the tobacco prevalence or smoking prevalence as high as what it used to be a few years back. In 2000 and I think 2007, it was about 22%, and more recently is about 19%. So the numbers are actually coming down when it comes to the smoking prevalence globally. But within the African continent, our decline is a bit slower than what is happening in the other parts of the world. And we have almost about 10 countries currently that have actually showed a slight increase in prevalence, smoking prevalence. So that shows that the rate at which we are actually coming down with our smoking prevalence is not as good as what is happening in the developed world. And one of the reasons that has been attributed to this slow decreasing prevalence that we are expecting to happen soon is the tobacco industry and its effect, and it's actually a global entity, and it's made up of so many companies and very powerful companies, state-owned entities, and have a lot of role when it comes to tobacco growing, manufacturing, importing, and a lot much effect on the economy of many countries within the region. And despite the harms that are noticed with tobacco, and we all know them very well, the industry really does not have much role to play when it comes to the harmful activities of tobacco on the body. And they consistently act in terms of delaying policy and many other ways that they affect the country's progress in many of these countries. And within the FCTC, or the Framework Convention on Tobacco Control, which was enforced in 2014, we have an article in it, Article 5.3, that really talks about the fact that countries should be able to protect themselves from the effects of these industries, and then they should have clear-cut policies on how much interference they should allow when it comes to industry interference. And there's really no scope when it comes to tobacco control within these countries, and that many countries should be able to protect themselves from the actions of the industry. And next slide, please. And if we look at this map, it's a global map that shows tobacco policy implementation in different parts of the world. And you can see that the deeper blue sections really show the high level of implementation of tobacco control policies. And you can see that within the African region, we are slightly on the lighter side, meaning that our tobacco control policies are not very much implemented like the other parts of the world, like what you can see in America, the Asia, or even South America, or parts of Europe. And that shows that the level at which we implement our tobacco control policies is actually weak and not properly enforced. So we have issues with tobacco control policies already, and that is what the tobacco industry tries to take advantage of. Next slide, please. And as we can see that we have several tobacco industries, but we have most of the interference actually is by the British American Tobacco Company. That really is the big shark in the African continent. And many of these countries within our region are serving like a potential market for the industry, and the industry is really banking on that to be able to enter these countries and to affect their population much more easily than what was happening in the developed world. Although we have many other companies as well, like the Philip Morris, Japan Tobacco International, Imperial Brands. They are all other companies. Many other companies also exist, but the British American Tobacco really has a big role to play when it comes to African countries and what they've been able to do within our setting. And there are many internal documents that have been found from leaked industry documents and what has been done by research, particularly from the University of Bath, which shows that there's a lot going on when it comes to advertising, marketing, and strategies related to sales within our region. And the BAT is strongly placed an advantage of the growth of these markets, because it's really trying to take over many of the things that it's not been able to do in the developed world, or it's just trying to move to this part of the world because it's become much more easier, and that we have a much more larger vulnerable population that really includes a lot of young people and women. Next slide, please. And the way the BAT responds within our setting is slightly different from the way it would have done in Europe or other developed part of the world. And it doesn't use the same principles because it uses many other ways of trying to enter the market, such as selling maybe cheap, highly addictive cigarettes within our setting. And there's also marketing that smoking is not harmful to health, despite so much of evidence against it. And then it also tries to use a lot of economical and political power because they're a very powerful industry, and then they try to use that to sort of enter and make their presence in these African markets. And they also go ahead to do a lot of advertising in print, in television, and the media, to show that tobacco smoking is not really as harmful as we think. And they sort of modernize and sophisticate a lot of these things to lure the public into thinking that tobacco smoking is not really as bad as it should look like. Next slide, please. And there's a lot of evidence currently, especially from the work that is being done at the University of Bath, and many of it has actually evidence that there's a lot of evidence that when it comes to tobacco smuggling, even many of these industries are responsible for that. And the documents that have been leaked or have been researched have actually documented that the BAT has been involved in smuggling in almost about 40 out of 54 African countries. And these activities began as early as 1980, and they still continue to persist, even it might not be as high as before, but they still occur at significant level. And there have been other ways that the industries also try to lure people, making them believe that smoking is more like a passport to prosperity, because many of the advertisements that they show have people wearing good clothes and look nice, and these sort of lure these young people to believing that smoking makes you more prosperous, makes you look more successful. So they have all these false ideas and beliefs that they put in many people in our part of the region. And next slide, please. And like I said earlier, that these companies target a lot of these new smokers and prospective smokers using a lot of marketing strategies, and they are very much likely to do that to women and younger groups. And an important way that these industries also try and enter our setting is by the use of single stick cigarette sales. I mean, in our part of the world, I think we are one of the most likely to be selling single sticks because they're more affordable, they're more cheaper, they're much more accessible. And that's another way of actually making cigarettes or tobacco much more accessible to the public. And these companies have also been found to be blackmailing politicians, bribing them and with all sorts of, whether it's money or any luxurious items that would lure them into passing some of their policies. And sometimes they offer free cigarettes to children to try to hook them onto it. They hire these young cigarette girls to endorse some of their products in some of these countries. And then one of the other ways is getting corporate social responsibility, doing a lot of these philanthropic kind of work that looks like they're actually helping the society, but in the end, it's all to their own benefit. And they've also gone ahead to provide electricity for small towns, or maybe even hospital supplies. I'll come to that later, somewhere in my presentation related to COVID and how they were such a key player when it comes to healthcare. Next slide, please. So in a nutshell, what the tobacco industry really uses, some of the tactics that they use for their survival is the fact that they influence policy, and many of the administrative decisions that are taken at the country level or the national level. They also interfere with several implementation of these tobacco control laws and activities. And we already do not have very strong policies and strong laws when it comes to tobacco control, because it has not been our main priorities, because we've given a lot of priority to infectious diseases within our African setting because of the incidence of malaria, HIV, and tuberculosis. So tobacco control really comes somewhere lower in the priority. And some of these industries actually make you take advantage of that. And then they also spread some sort of false propaganda and hide the truth behind what tobacco actually does. They manipulate these politicians and these frontline workers, or maybe these decision makers, into believing or into passing some of their policies, or making some of these enforcement of these policies much more difficult. And then they also have a lot of effect when it comes to tobacco advertising and promotions and sponsorship of their products. So they have several ways they do that, but this is really some of the key ways that they try to interfere in many country policies when it comes to tobacco control. Next slide, please. And more specifically, the way they do that is when it comes to, for instance, for taxes, they always try to prevent the government from raising some of these taxes. So they prefer low rates, or they want taxes to be raised gradually. So that's some of the ways they try to affect some of these specific tobacco control laws at country level. For instance, for smoke-free policies, they would want countries to keep a designated smoking area already in place, and not go in for a comprehensive smoke-free policy, which does not allow smoking to be happening in any public area, but they would want a designated smoking area, or they would want certain areas to be restricted from smoking, from actually putting up a smoking ban, especially the hospitality venues like restaurants, bars, and hotels. And they will make sure that there's a lot of weak enforcement mechanisms when it comes to pushing these smoke-free policies. When it comes to tobacco labeling, they would want their labels to cover a much more smaller amount on the pack as compared to what the recommendations by the WHO are. So they would want it not to exceed between 30 and 50%, which is not actually what the recommendations say. And they would also want to have these different pack sizes, like kiddie sizes, or get a lot of promotional materials when it comes to packaging to make them more attractive. Then, of course, the corporate social responsibility that some of these do, like during disasters and emergency situations. In terms of advertising, they would want to advertise at the point of sales, though they push for some of these policies, and they do not even ban any social responsibility sponsorships. And when it comes to promotions, they only would want promotions to be prohibited for minors, but they would want it to be done for the other groups of the population. For illicit tobacco trade, they would want, of course, they would not want the protocol to be passed when it comes to country levels. They would also want arrangements which would have anti-smuggling laws, but behind the scenes, they're actually doing something else. So these are some of the specific ways that they try to interfere in country policies when it comes to tobacco control. Next slide, please. So it's been found by a lot of research work that has been done that Africa might be the world's ashtray if big tobacco is able to get its way. And we see that happening with some of the current evidences that we see when it comes to how much the tobacco industry is able to push their way into the African region. Next slide, please. So I'll just move ahead to give you a few regional updates when it comes to the 2021 and 2022 Tobacco Industry Interference Index. And next slide, please. And this, the Industry Interference Index is actually a civil society report that is generated sometimes every year or every 2 years, depending on where you are. And it has to do with 20 questions that cover 7 main indicators of how much the tobacco industry interferes in country level tobacco control efforts. And these are then scored out of 100. So the higher scores you have means the worse you are. The lower the score, the better off you are. And the 7 indicators are participation of these industries in policy development. So how much the tobacco industries are interfering or participating in policy development. Then the next one is how they're able to do a lot of corporate social responsibility, although it's sort of a denormalized practice, but it does happen. So one of the indicators is their role in corporate social responsibility. And the third one is what actions we do that benefits the industry. So how do some of our activities benefit the industry indirectly or directly? And what are some of the industry unnecessary interactions that happen between government and tobacco industry? That's the fourth one. And the fifth one is whether there are policies in place that measures transparency between the government industry interactions, and if these are made publicly available. Then the sixth one is conflict of interest. So whether we have any conflicts of interest between officials that work within the government and the industry, or they have certain roles to play within the industry, even though they belong to the government. Then the final one is the preventive measures. So what countries put in place when it comes to preventing themselves from interference or interactions with the industry. Next slide, please. So in a nutshell, what the figure here really shows you what happened in 2021. So you can see that the lighter colors from yellow is the low scores, meaning that that's the good one. There's least interference or low interference. And as you go towards your right, the dark colors indicate that there's more interference. So if you can see within our region, our countries mostly are within the blue and light blue and getting to the red. So the average scoring is about between 50 to 59 or 60 to 69 onwards. So that tells you that we are not really protected when it comes to the tobacco industry. And there's a lot of interference.
Allô? Allô? Dr. Ati? Dr. Ati? Okay, we hear you. Go on. Go on, you have the floor. Oui, peut-être encore un problème de souci avec le son du docteur Ati. Je pense que nous avons suivi l'essentiel. Si elle est déjà...
Dr. Ati, are you still on? We still have a problem with you. Dr. Ati, can you hear us? Hello, Dr. Ati?
Dr. Ati?
Yes, please. Next slide. I don't know if you can go to the next slide. Yes, please. When it comes to measuring transparency with the industry, governments are actually able to be, they're supposed to be transparent when it comes to any interactions. But yes, we have countries like Ethiopia, which have actually publicly disclosed their interactions with the industry. And in terms of conflict of interest, we are not supposed to have government officials to be on both places in the industry or having positions within the industry or in their advisory boards or committees that the industry has put up. But we have countries like Kenya and Cote d'Ivoire where tobacco industry officials actually sit on certain committees of the government. And even in Kenya, for instance, we have government officials that have actually served as members within the BAT Kenya. And in terms of preventive measures, the last indicator, certain countries are able to take measures to be able to protect their public policies and their population from these tobacco industry interference. But we have countries like Burkina Faso, Zambia, Ghana, which have really no mechanism in place for exposing these government officials' interactions with industries. But we have also some good examples like Nigeria and Uganda, which actually have some preventive measures in place for disclosing some of these government dealings with the industry, which is actually a way of preventing some of their policies in place. Next slide, please. So the main highlights that we observed when it comes to the 2021 and 2022 reports is that only two countries, Ethiopia and Nigeria, have been able to show some level of improvement, but we have about 7 countries, including Zambia, Ghana, Senegal, Cote d'Ivoire, Gabon, Kenya, and Uganda, which have actually showed deterioration in the index, although it's not to the same level. I would say Zambia was much more deteriorating than maybe, for instance, Ghana or Uganda. Some of them have very little deterioration or just maybe a 1 point or 2 points. But with Ethiopia showing improvement from 49 points to almost 30, that was a huge improvement on the side of Ethiopia, whereas Zambia registered a large deterioration from 78 points to 81 points, which was sort of one of the highest deterioration rates on the index. Next slide, please. And some of the reasons why Ethiopia might have done really well when it comes to getting better with the industry in index scores is that there was actually a good reduction in any conflict of interest between the government and the industry. And there was also a little reduced participation of these industry in policy development. So they were able to manage all that quite well. And in Ethiopia also continues to withdraw from its participation with anything to do with Japan Tobacco International. So it's more of like a fully privatized industry now. Uganda also on the positive side, the advisory board, the Tobacco Control Advisory Board, and the regulatory body has many members, excluding anyone from the industry, which is also quite a good plus for the country. But in Zambia, for instance, where we've seen some amount of deterioration, it's mostly been attributed to the fact that they have a lot of participation of the industry in policy development. There's also a lack of transparency, and there have been many practices that have actually benefited the industry when it comes to policy development. Tanzania has actually remained at the same point from 2021 to 2022 at the point of 73 points. And this has mainly been due to a lack of preventive measures that the government is able to take when it comes to protecting their policies from being affected by the industry. Next slide, please. And let's not forget the effect of the COVID pandemic when it comes to big tobacco and what these industries have been able to do. So the pandemic was actually a golden opportunity for these industries to really bank on. And they did a lot of corporate social responsibility at many levels that really benefited them to many extent. And we thought that they were actually being very empathetic and very, but they had their own agenda. Actually, as usual, they had no better agenda doing all that, and they only were doing that to benefit their own interest. Next slide, please. And when it comes to more specifically what they were doing in certain countries within our region, actually, so this really shows you a summary of what they did in many of these countries. For instance, in Ethiopia, they had lots of donations when it comes to sanitizers and personal protective equipment, which was what was really necessary during COVID, the pandemic. In Kenya as well, they donated lots of funds, almost about $100,000 to an emergency response fund related to COVID. Countries like in Uganda also, they had similar role to play. And for instance, in Tanzania, they also donated equipments worth about almost $38 million to these government officials for medical usage when it comes to the COVID recovery fund, sort of. So they were doing that all in the name of COVID, but behind the scenes, they were all doing that just for their own benefits. Next slide, please. So some of the recommendations that we can come across when it comes to how we can protect ourselves from the industry and what some of our countries could do when it comes to protecting themselves. I will just highlight a few of them, although there might be many, but some of the key ones that we came across was, can you please go to the next slide, please? Was, maybe before I go ahead, I think that we have lots of interference with the industry, but we also have lot of good stories that we can also pass within our region. So for instance, Ghana recently passed an excise duty amendment bill on tobacco, alcohol, and sugary beverages, which has just recently been passed as of last week. So that is really a big plus for the country, despite all the industry that affects some of these policy passages in these countries. Rwanda also ratified the protocol on the illicit tobacco trade, despite industry interference. In Kenya, we've also seen a lot of advocacy going on around regulating the usage of e-cigarettes and other tobacco alternatives. And this is all due to the increasing popularity of e-cigarettes. In Sierra Leone, actually, they have just been the latest country to have a tobacco control law that has been passed within our region, within the WHO African region. So you can see that despite all the interference, we still have a lot of good stories to talk about within the region, that the countries are still trying to overcome some of these industry interference and move ahead with some of their important policies. Next slide, please. So some of the recommendations, I think, would just stem from the fact that in the index, actually, the scores that have been generated by these the tobacco industry interference scores has to do with some of these corporate social responsibilities. So we must really take measures to be able to protect ourselves and denormalize the practice of any social responsibility from the industry. We have nothing to gain from these, taking anything from the industry. They have all to gain, and they're really doing that for their own benefits, and they have no good interest or heart for any organization or any country that they decide to help. And the fact that we should also decrease any open communication with the tobacco business is also one recommendation that I can see coming clearly from some of the findings that we saw. And any engagement with the industry should be documented and made available to the public. It's also important that we prohibit the industry from influencing any policy, and I think that's very clear with the effect of the industry on many of these policies. And a lot of these non-health organizations or civil society organizations should also combat these industry meddling and prevent the industry from undermining or postponing these tobacco control measures. Next slide, please. And some of our public health leaders or government officials was also shielded from any influence of these industries, and they should be allowed to develop and administer the regulations without any industry effect. Then we should also have a code of conduct, which has been really one of the recommendations that have been coming out from many of these index scores, even at the global level, that we should have a code of conduct that sets guidelines that protects these governments from industry interference. Government should also be able to reject sort of any or non-binding agreements that the industry comes around to play with them with. And our governments in the region should also think of monitoring tobacco use and the industry as well, because that's the only way we know how we we are performing when it comes to industry interference. And that's actually one of the main reasons why we do these index scores every year or every 2 years, to be able to know what's happening at country level, so that we can then put in preventive measures at country level and a regional level as well. And I think that is my last slide. So I thank you all for giving me the opportunity to share the findings of the industry interference index report and the updates from the reports that we have done. Thank you.
She talked about the tactics of the tobacco industry interference in policies. She talked about some multinationals operating on the African continent, Phyllis Morris International, Imperial, Japan Tobacco, and many others. And she focused a lot on BAT activities operating on the African continent, 40 countries out of the 54 on the continent, and since the 80s. And she particularly highlights the tactics used by the tobacco industry to try to lure some new smokers, gifts of cigarettes to the young people, sale of cigarettes like stick, and also we have offering electricity in some small towns and villages, and gifts in hospitals. And these are some of the strategies used by the tobacco industry. Talking about the interference of the tobacco industry, she presented a few countries with the score that they have: Zambia 78, Tanzania 73, South Africa 64, Uganda 34, Kenya 39, Gabon 48. She stated that only Ethiopia and Nigeria have made some progress from 2021 to 2022. These countries have recorded deterioration of their index due to the high level of interference of the tobacco industry and a weakness of public policies. And we have regulations, and in many countries, she noted that so far, only 38 African countries have a legislation, tobacco legislation, tobacco control legislation in place in the Africa WHO region. And she made recommendations, target actions with each of the indicators. She talked about 7 indicators regarding the preventive measures, corporate social responsibility, CSR, and there is a need to take appropriate measures for each indicators and put in place a better coordination at the level of the government, and put in place a good monitoring system. And the role of the civil society is very important, crucial, with advocacy activities of therefore public policies and protecting those policies. This is then, in a nutshell, the highlights of the presentation of Dr. Arti. We'll have the copy of this presentation. We're going to continue with the next presenter. Friends, we're going to take Dr. Egbe before Sanele. Dr. Egbe is going to be on the... Dr. Catherine Egbe, she's a specialist in science. South Africa Research Council. She's going to deal with how we can put in place, how to put an end. We've lost the speaker. We've lost the speaker in Africa. Dr. Egbe.
Yeah, can you hear me?
The end of tobacco, exploring an African perspective. Can you hear us? Go ahead.
Yes, I can hear you. Can I go ahead?
Yes, you can, ma'am. Go ahead.
Okay, let me share my screen, just a minute. And please let me know if you can see my screen. Can you see my screen? Okay, great. Okay. Thank you very much for inviting me. I'll just switch off the video while I do my presentation just to enhance the quality of the presentation. So this, I'm presenting on a study we conducted in 2021, 2022. So we titled it Exploring an African Perspective Towards Ending the Tobacco Epidemic. I made this presentation in this last annual conference of the Society for Research on Nicotine and Tobacco, but I'm making it here again because this is a very a group that should be very concerned about this topic, and I felt that they were not in that conference. So this is a good opportunity to share these findings with you. These are my co-authors, some in the South African Medical Research Council and one in the University of California, San Francisco. Sorry, excuse me. So just to disclose that the study was funded by a rating grant I received from the South African National Research Foundation, and the authors, all other authors do not have any other thing to declare. So just to introduce the concepts, tobacco endgame, I'm sure maybe a couple of us must have heard about tobacco endgame, New Zealand, and so on. So in a nutshell, it is the permanent eradication of tobacco, or at least reducing it to a very low prevalence, as low as less than 5%. And the concept actually is an umbrella concept for any strategy that would either change or permanently eliminate anything that is sustaining the tobacco epidemic, anything that could be structural factors, political factors, social dynamics, anything that is sustaining the tobacco epidemic, anything that can change it or permanently eliminate those things that will continue to make tobacco be part of our lives. So that is what this concept is all about, trying to understand how we can bring that to reality. So the reason why we're doing this is because we know, as the previous speakers have said, that tobacco causes diseases, and Africa is being seen as the replacement market for the reduction in smoking prevalence in the Western world. And we are seen as a market that has the potential to grow for two reasons, I would say. The first one being the fact that we have the youngest population in the world in terms of the continents, and because there is, of course, room for economic growth in the population. So as more people get to get more jobs or get jobs or grow and become members of the working class, then they have more funds at their disposal. So they have more funds to use to buy tobacco, something like that. So the rationale is basically that if we want to leave Africa out of the discussion of tobacco endgame, we may be having the same problems as many of the countries in the West are having, where they have progressed in the tobacco epidemic. So you're having like very many cases of tobacco-related diseases. And COVID-19 taught us that we are not really prepared to handle an epidemic that can, really affect so many people because of our very fragile health system. And so that's the importance of us having this discussion now, so that we don't get to that stage where we will be fighting to keep our people healthy and keep our hospitals running. So the aim of the study is to ascertain what tobacco control, or what tobacco endgame, not tobacco control, tobacco endgame strategies that we can put in place in sub-Saharan Africa. And what do stakeholders in this region think can work? And why do they think these strategies can work? It's just to explore, just to find out what they think. And I'm sure some of the people who participated in this study are even in this webinar. So it's interesting to have you guys here, and of course, feedback will be very much welcome after this presentation. So what method did we use? So this study is supposed to be a mixed method study. That means that there is supposed to be 2 phases. The first phase is the qualitative phase. The second phase will be the quantitative phase. We have not started the quantitative phase because of resource constraints, but we've completed the qualitative phase. And the qualitative phase involved us conducting key informant interviews among stakeholders within the region. And the inclusion criteria was that they had to be adults, they have to be residing in the region, they have to be residing in Sub-Saharan Africa, and they have to have worked for more than 1 year or more in the tobacco control space, so that we are sure that they're giving us informed take about this issue. And so we did purposive sampling, and then from there we did snowball sampling, where we asked people to recommend to us other people that they think fit into these criteria that we're looking for, the people we're looking for. So we conducted semi-structured interviews. We had an interview guide. And of course, because we know that our region has 2 major languages, French and English, we conducted interviews in both French and English, depending on what the respondent wanted. I think it was only Mozambique where the participant wanted Portuguese, but we don't have any Portuguese research assistant, so the participants was gracious enough to agree to participate with, I think, English or French, I can't remember now. So we did a data analysis using NVivo, a software for qualitative data analysis. And this is just a summary of the social demographics of our participants. We got 29 participants from 12 countries in Sub-Saharan Africa. And you can see the breakdown of the countries there. And most of them were males. And we got people from 3 different sectors, non-governmental organizations and civil society organizations, and then government departments and research and academia. So we got 4 major themes from our analysis. That means respondents majorly mentioned these issues as what they think we need to do in Africa to bring an end to the tobacco endgame. And the first one was African or regional policy or Afrocentric strategies. And one of our respondents described it as the African Charter for Endgame. We should start talking about an African Charter for Endgame. And the second one was education and awareness strategies. The third one was support strategies, support for smokers to stop smoking. And then all other strategies that didn't fall into these 3 categories, we put them as other strategies. So just to dig deeper into these strategies, the first one, the regional policy, participants mentioned that we need to have strategies that are sensitive to the culture and the regional dynamics in the African region. And especially because some of our countries are tobacco producing countries. So they rely on these products, or they rely on the tobacco farming and tobacco leaf production for foreign direct investment. So if you just take that away from them without thinking of a replacement or without giving them an option, it's more likely that they would not buy into that strategy. So this was the discussion that one of them, some of our participants mentioned. And then the second thing under this strategy was that whatever it is that we're putting together, whether an African Charter for Endgame or Afrocentric strategy, they must have clearly defined goals. They must be systematically organized, For example, you can have you can make it compulsory for people who want to sell tobacco to have license, just like you have for alcohol. In South Africa, you can't sell alcohol without a license. So they felt if you have that, that could kind of have a control over the market. And then there's also the issue of smoke-free generation, like you have it in New Zealand. And they felt we could have something like that, something that you can easily monitor as well and measure. And then the last key sub-theme under this thing was that because of the entrance of the novel products into the market, most of the laws that we have are not really comprehensive enough to cover these products. And so there's need for African countries to take that step. They shouldn't wait for these products to come into their market before they start thinking of regulating them. Because, for example, if they are in South Africa, it's likely that they will go to Zimbabwe, and they will be in Zambia, or they will be in other Southern African countries. The same if they're in Ghana, it's likely to be in Nigeria very soon, or in the neighboring countries. So respondents think that African countries need to become more serious about regulating these novel products, because the industry is using it to have inroads into the market. And then there's also the issue of implementing the WHO FCTC and signing the illicit trade protocol, essentially just to do those things that we are expected to do as countries or as a continent, to key into the international strategies to reduce tobacco use, was what this theme was talking about. So the second one is education and awareness strategies, which included the organizing education and awareness campaigns. And this should be to target various groups, not just an overall broad awareness campaign, but something that can target groups like students, like workers, like women, like youth, like that. And then, of course, the use of new media, because we know that most of the laws we have, they mostly talk about the traditional media. Tobacco is banned, the TAPS ban, for example, they are mostly talking about traditional media. And then there's always that broad statement. If they ever go into the new media, there's that broad statement about advertising in the internet. But there's no really core mention of, for example, the use of social media and different types or different forms in which this advertisement can be used, can be propagated using this media. So they also think that we should use new media to increase awareness. We should also tap into the entertainment industry, because Africa is very concerned about entertainment. We're very concerned about our music, our films. And so we should be thinking of using these media to promote awareness about the products. Because we also know that the industry uses this media to encourage young people to smoke. Most of our movies now, you see people using these products indiscriminately. There's also the suggestion to have health initiatives in rural areas, because most of the time when we do all this new media stuff, we find out that the rural people living in rural areas are left behind. There's nothing for them. So this theme was really suggesting that we should have initiatives that should target rural areas as well. And the last one under this theme was the use of religious leaders, or the involvement of religious leaders in advocacy, because we know that we are also big on religion as a continent. They felt that if we bring in the religious leaders, just like with the HIV campaigns, at some point they had faith-based organizations that were involved in raising awareness and forming support groups for people infected with HIV. So the suggestion was that we should use the same template for tobacco endgame. The third one is the increase support strategies, and these include increasing prevention efforts, cessation services also in health facilities. These are two different things put together, because prevention is for those who have not used and cessation is for those who are using. They also mentioned about having in place toll-free lines, national toll-free lines, because many smokers want to stop, but they don't know who to talk to. They've tried their own personal means, but don't really get the support. And we know that just counseling someone, just telling someone you can do this, it's sometimes enough for the person to initiate cessation attempts. So these toll-free lines, they need to be put in place at national levels. And then some interestingly mentioned about exploration of herbal remedies for nicotine addiction, because they felt that since Africa is very big on traditional medicines, these tradomeds can be used to also look at how to help people to cope with addiction to nicotine. And then, of course, alternative sources of income to tobacco farmers. Like I mentioned earlier, you can't take away tobacco farming without giving them an alternative. Then it means you are essentially leaving them to remain poor, even though we know that there's really not much that they get from the tobacco. But at least if you give them something that is an alternative, they will feel that you care for them. And that's what some of these respondents mentioned. So lastly, the other strategies were like the use of sports. We also know that Africa is big on sports, and they felt that if we get people, even in the sports world, to be ambassadors, that would be great. And even in the sporting festivals that are held in the continent, to use them to promote tobacco endgame. There's also the importance of reliable and robust local research, because we know that most of our policymakers, they want to see papers that reflect the context or that the laws are being made, because you can't, if you bring studies that have been done in the Western world and you give it to them, the amount of interest they will have cannot be compared to when you give them something, for example, that was done in South Africa, or something that was done in Nigeria or in Ghana or in Ethiopia. So participants felt that we need to encourage local research, and not just local research, but robust research that follow all the scientific procedure to make them credible for use by policymakers. Of course, there's industry monitoring. There's no way we can achieve anything without industry monitoring. The last speaker, Dr. Ati, just mentioned about how much the industry has their claws all over Africa. There's no way we can do these strategies, we can implement them without really having a strategic means of not just monitoring, but countering and proactively preventing them from interfering with the policy. And lastly, participants mentioned that we need to have also country-specific endgame strategy, just like you have with the WHO FCTC, where each country then goes to domesticate the policy. So also when we have, for example, the Africa Charter on Tobacco Endgame, then each country needs to now bring it to life in their country and make it adapted to be more sensitive to their setting. And that for them is what will make it work and what will enhance ownership of these policies to bring an end to tobacco use. So the success of tobacco endgame strategies, participants mentioned that for it to succeed, we need to, when you've put in place the right policy and everything and all the paperwork, for it to succeed, they felt there are 7 things that should be done. First, there needs to be effective awareness campaigns about the strategies, about the policy, and then there needs to be political will from the policymakers, and there should be an all hands on deck approach. That is, there should be multi-sectorial collaboration between government and civil society, and collaboration among government organizations, government agencies to increase effective implementation. Then they also mentioned that there needs to be availability of funds, because most of the time they put laws and then there are no funds to back up the effective implementation and monitoring of these laws. So countries should also be able to commit financially to making sure that these strategies are fully implemented. And of course, to get a buy-in from the public, an effective awareness campaign will be the trick. And of course, we will need to have different sectors of the public being responsible for, pushing some of these messages. For example, you can get the medical association of that country to push cessation. You can get the educational sector to push prevention in schools and so on. So when you get that buy-in from the public, then you'll be more certain that these strategies will work. I've mentioned industry monitoring before. And lastly, a systemic and coordinated approach is what will make it come to pass. In conclusion, tobacco control stakeholders, based on what we've seen from this study, they are really interested in us having some tobacco endgame strategies implemented in the African continent. And this is because they believe that tobacco is detrimental to the health of the continent, and the earlier we start doing something about it, the better. And lastly, there's need to initiate evidence-based Afrocentric strategies that are geared towards ending tobacco use for good in the continent. Thank you very much, and that's the end of my presentation.
Merci. And this is the presentation of Dr. Catherine Egbe, the approach that she has created, a strategy that suggests help African countries to end the game of tobacco industry. She came across the qualitative research in African countries because it is one of the weaknesses in Africa, the science of data. So she suggests that African countries adopt the African strategy endgame. And in this strategy, there are many approaches that could be used, especially awareness campaigns and also education that should also address media. She also mentioned to set strategies for each country and each adapting its strategies to the needs, because Africa has specific needs, but each country also had specific needs. This is why each country should set up its strategy. She ended her presentation by showing elements that could help the implementation of the strategy, the endgame strategy. She mentioned education and drawing people awareness, political will, because without that, it won't be possible to move in the fight, the availability of funds, because we know that one of the major issues is also resources and funds to go through with activities. Monitoring was also mentioned, and it is equally important. We also have coordination and the multi-sectoral field. This is here the summary of the presentation of Dr. Catherine Egbe. And I believe the presentation will be sent to all participants. Just before we move forward with the other presentation, you can add your questions in the question QA and discussion section. So each panelist will be available to answer the questions as regarded to their topics. We will move forward with our next panelist. It will be Sanele Tulu, who is responsible of South Africa for Youth Forum. He is engaged in youth, is targeting the youth. If Mr. Zulu is online and available, we are going to give him the floor. Mr. Sanele, you have the floor. Can you hear us?
I'm here. Good afternoon.
Okay,
Bonsoir à tous.
I'm not sure if you guys can hear me.
Yeah, I can hear you. Go ahead.
You have the floor.
Oh, perfect. No, colleagues. So, no, thank you so much, Prince. Thank you to the colleagues. Thank our panelists. Mine will be very short. I think, I'm Sanele, as I've said, Sanele Zulu. I'm from South Africa. Tobacco Free Youth Forum, the South African Tobacco Free Youth Foundation, in our lifetime, a smoke-free generation in our lifetime. And that's what we really believe in South Africa as well. We're hoping that one day we can claim that we're a smoke-free generation in our lifetime. That's what we hope to see. That's what we envision to see as the young people of South Africa. So in a nutshell, what we do as a tobacco control in the tobacco control space is that, in South Africa, I must say it's quite a new topic of discussion. It's something that not many people know about. And I can say that almost every country, for sure, young people are not well aware of what tobacco control is all about. And I think that puts us in a position really to say, what is it that we need to do to ensure that tobacco control becomes fashionable amongst young people? Tobacco control becomes fashionable. I think mine is to say youth are not educated about tobacco control. They don't know about it, and therefore, when young people don't know anything about it, it means that our young people will continue dying. Our young people will continue to perish. And for me, that's the first thing. And the second thing is that youth are the biggest target audience when it comes to the industry, and the most gullible, by the way. Youth are the most gullible audience for the target or for the industry, and easily influenced group. So for us, I think it also gives us a question mark to say, how far should we really go in as far as involving young people in this tobacco control discussion? Because if we know that young people are gullible and young people are easily influenced by the industry, how much more effort should we put in ensuring that in every country in Africa, there are young people represented in the issues related to tobacco control? And then I must say as well, thirdly, that youth advocacy is the single most powerful campaign that can change the landscape of tobacco control. That youth advocacy is the single most powerful campaign that can change the landscape of tobacco control. And I say this boldly because in South Africa, we've seen young people change the political landscape. We've seen young people gather together, fight, against politicians. So I want to implore and explode an idea to our colleagues here to say, if in any country there's no youth involvement in terms of tobacco control related issues, I don't believe that the landscape of tobacco control in that country will change much, because young people are the biggest audience that are targeted by the industry, but also young people are the biggest audience that has got influence. So for me, in order for us to promote, a healthier society through tobacco control, we must prioritize youth involvement, young people getting involved in tobacco control. And I must say that, it's not many young people that have got an understanding, that have got an interest in the topic that we're talking about today. But I want to implore you, colleagues, to say, let's galvanize young people, let's educate them, and let's get them to be part of the tobacco control movement. And then the fourth thing that I want to talk about is training and continuous mentorship for advocates or youth advocacy groups. To say there are some young people, for example, that have got interest in tobacco control, but there must be some form of continuous training. There must be some form of continuous mentorship, because I can tell you now, we can never change the world if the ones that have gone ahead of us do not pass the baton. There must be those that are willing to pass the baton. There must be those that are willing to train the younger group that are coming in front. And when I talk about, we must train them on the technical side, and policies are about the industry, the tactics of the industry. We must train them on that. That's the content. That's basically the information. But the other thing, and the other point, which is my fifth point, is to say we must engage young people at their level of interest. We must engage young people at the level of interest. And what do I mean by that? We must engage young people by talking about communications, comms. We must talk to young people through social media. We must talk to young people through media. We must not shy away from talking to young people through celebrities. We must talk to young people at their level of interest. The biggest mistake that politicians make is that they always assume that they know what young people want all the time. The biggest mistake we can make in the tobacco industry space is to also assume that we know how young people want us to communicate with them. In South Africa, we say nothing for us without us. So you can never talk about a youth program without involving youth. You can never talk about youth advocacy without involving youth. And I must applaud ADCA for ensuring that there's youth representation even on this panel today. But for me, it shows a willingness to ensure that there's no discussion that happens about young people without young people being involved. Because our experience and our knowledge, can actually inform some research, can inform some of the ways that things are done within the tobacco industry. So I want to then say we must also be proactive and not reactive towards the topic of youth advocacy and tobacco control. We must definitely be proactive because the industry is moving fast, it's moving quick. So we must also then be alerted to say, what do we need to do to be proactive? So that we don't wait for the industry to make the first move on social media, on marketing, on communications, then we respond to that. But we must be proactive and basically implement certain campaigns before the industry even does. And then my last point is to talk about skills, to talk about jobs and volunteerism, because we must remember young people are facing a lot of challenges. We can talk about tobacco control, we can talk about a healthier society, but at some point we must try and relate all these issues to societal issues, to say our young people are facing unemployment, young people are facing joblessness, young people are not skilled. So I've always said that to our group, that the only way we'll meet young people at the level of their interest is when we start engaging them about skills. Then as we talk about tobacco control, we must also talk about skills development. As we talk about tobacco control related to youth, we must also talk about volunteerism. Why should young people volunteer their time? Why should they get interested in participating in issues relating to tobacco control? Can we secure jobs for them? We secure departments involved to ensure that they are to be empowered. And I think this and across the continent. And my last question is, people don't care how much you know until they know how much you care. It's a quote I believe in strongly that says, people don't care how much you know until they know how much you care. And mine is to say that as we push for tobacco control and youth advocacy in the tobacco control space, we must show some level of care, not judgmental to young people. I must just alert colleagues as well here to say, most young people, when they feel that you are being judgmental towards them, then they run away from the truth. Get involved, and we give them a purpose, driven content and conversation around tobacco control issues. They will join gladly, but we don't have to tell them what they are doing wrong. They already know what they are doing wrong. So I think for me, that was the last one to say, we must then make tobacco control for a better health fashionable. It must be sexy, it must be fashionable for young people to want to be participants, to want to converse, to want to come to a conference of tobacco control. So we must focus on ensuring that young people are told the benefits as well, of tobacco control, instead of just talking about the bad. But let's tell young people, how do they stand to benefit from this? So in my closing, and I know that I'm sharing from the heart, but I have my notes here as well to say, really, let's talk to young people with the biggest question that they will ask us, and they continue to ask us, Sanele, why should I be part of this movement? Why should I care? Why? What do I stand to benefit? And once we answer that question of why should young people join tobacco control, and that question will give us the solution in ensuring that the industry does not continuously engage our young people and lure them in with their lies and with their celebrities and with all the information that is wrong. So for me, I think I'll end it there for today, but to say, let's make sure that in every country, we get our young people involved. They are the future generation. In fact, they are the now generation. And therefore, we cannot leave them out in the conversations of tobacco control. Thank you so much.
Thank you. Thank you for this important message. We must engage youth, because youth are already be targeted by the tobacco industry. I hope this message will get very well for those stakeholders who are here.
And gentlemen, that was the last presentation that was supposed to remind us the role of our work. He reminded us that the youth is the target of the tobacco industry as consumers, but also as key actors, because tobacco industry often use youth to attract more young people. This is why we should try as much as possible to interest the youth, to prepare them so they can avoid the issues of the tobacco industry. This is the information sent to us by Mr. Sanele. We are going to now go through the questions that we have. We are only going to answer a few questions because we have a short time.
There is a question for Dr. Catherine Ebe. Judith Asina was asking, is there a linkage between tobacco and alcohol that the young people are consuming in DRC, the linkage between tobacco and alcohol? A member of the panel can address this question. Is it any linkage between tobacco and alcohol consumption? Prof. Kumako, Dr. Arti, any linkage between tobacco and alcohol consumption? Can any member of the panel take this question, please? Any member of the panel would like to take this one? Hello? Hello? Another question from Senegal. The Senegal program, she's in charge of the digital part of the program. She commends the presenters that they have a problem with advocacy and awareness creation. And the novel tobacco products are sold by young people. And for the young people, what strategy should we adopt for the novel tobacco product to avoid the youth falling into this trap of the novel tobacco product? Mrs. Zanele, can you take this question?
Yes, can you answer for the question?
Mrs. Zanele.
Please translate the question. I couldn't understand it.
The question is that the new product of tobacco are massively sell in youth milieu by the youth. Which approach, which strategy can we put to target to fight against those practices?
Okay, I think for me, it goes back again to saying that the best way is to educate our young people. I can tell you that there's a word that says, "My people perish because they lack knowledge." And for me, many of our young people are perishing because they don't know. And the more that they don't know, they think they know. So for me, it's about educating our young people, one. But two, we then need to galvanize the young people that have got interest. You know, the non-smokers, the young people that have got interest in the tobacco control space already. We educate them more, we train them more, so they can go out into the community. What we've done in South Africa, by the way, we've written it into parliament, written to industry, to say that as young people, we can see and we take a stand against the works that of they are doing, the doing of their works. You know, so we continue to fight for the bill. And I think for me, it's just about ensuring that our young people are educated. And the more educated they are about the harsh reality of tobacco, is the less we'll get young people involved.
Okay, thank you, Mr. Zane, for this answer. I think we are going to end this webinar because we are already reached in the end. Donc, mesdames et messieurs,
ladies and gentlemen, the time for this webinar is already here. We know that there are a lot of questions, but we are sorry we can't address all of them. We hope that these questions will find answers maybe later, or the presentations will be sent to you. I would like to summarize by saying that this webinar was organized in memory of the World Health Day, and the theme for this year is health for everyone. And ADCAS chose the theme health for all through a smoke-free generation. We had a presentation from people, very important people in the fight against tobacco, Mr. Komako Vigno-Vincent, Dr. Arti Singh, Sanele Zulu, and Dr. Catherine Egbe. We would like to thank them very much, and thank you to ADCA for organizing this seminar. We lost already, we don't have the sound. That gave us the opportunity to learn more on means to reach our target of WHO for tobacco in the world and in our continent. I would like to thank you very much and see you next time. Thank you. Documents and presentation will be sent to you in your mailboxes. Thank you.